Hi, this is Kim Bland, and I'm currently a student at Southeastern University. Today, we will be talking about cultural humility. This is a theoretical framework presentation. As an overview, we will be defining this theory, the history and background, key components, visuals that hopefully help you identify and see a clearer picture of this theory, empirical research to support the theory, critique of the theory, and application of the theory. And finally, we'll be indicating the references that I used throughout this presentation. The definition of cultural humility is that it is a lifelong process of learning. Cultural humility is used when individuals have mutual empowerment, partnerships, respect, optimal care, and lifelong learning connected to the following contexts: ethnic and racial differences, differences in sexual preferences, social status, interprofessional roles and relationships. Furthermore, an interpersonal stance is being others focused, not self focused, and displaying respect towards others' backgrounds and others' experiences. Cultural humility is general humility that centers on cultural differences. Cultural differences include race, gender, sexual orientation, and ideological differences. The fluidity and the subjectivity of culture that challenges others to address inequities. The history and background of cultural humility started in the early 1970s. This is when multicultural awareness and knowledge started to be developed. The counseling profession indicated the need for a proactive stance on cultural diversity. In the past few years, there has been a movement from cultural sensitivity and cultural competency to cultural humility. This is a visual that I'd like you to take a look at. It is the model of care. As you take a look at the model of care, it starts off with cultural awareness. It then goes into cultural knowledge, cultural skills, cultural encounters, into cultural desires. This is the flow of what it looks like of somebody who is interested in understanding the hierarchy of learning what it takes to be a person of cultural humility. The key components of this is openness, self-awareness, egoless, supportive interactions, and self-reflection and critique. So as we take a look at openness, we must have an open mind or be open to interaction. We have to have a willing to explore new ideas, an openness to develop a knowledge and understanding of other worldviews, and the openness to the concept of humility and the focus on opening up to others. In regards to self-awareness, awareness of strengths, limitations, values, beliefs, behaviors, and appearance to others is important for us to become aware of. We need to develop an awareness of personal attitudes, values, and beliefs, and how to understand how they might affect personal cultural influence. Humble people accurately view themselves. Cultural humility cultivates self-awareness, acknowledging how values and structural forces shape client experiences and opportunities. And finally, self-awareness helps us to understand ourselves at a deeper level and analyze our power and privileges. Egoless is throwing away your ego. The worth of all individuals is on a horizontal plane. Belief system of equality towards human rights, not a hierarchy of power. Others focused, not self-focused. Displaying a lack of superiority despite cultural differences. In regards to supportive interaction, this is a positive and supportive human exchange. We use appropriate skills, and we collaborate with clients to understand their unique aspects. Finally, in self-reflection and critique, it is a continual reflection and refinements of our thoughts, feelings, and actions. This is lifelong learning in regards to self-reflection and self-critique, and this is necessary. This is another visual in regards to reviewing being more humble. It is the QIAN model. Q is self-questioning and critique. I is bidirectional and cultural immersion. A, active listening. N, flexibility of negotiation. This is just something to think about as you continue to think about becoming more cultural in your humility. The results of achieving cultural humility include empowerment, respect, partnerships, optimal care, and lifelong learning. Some research that supports cultural humility. Some research that was conducted by Hook found that cultural humility is a virtue that is important to therapy clients. Also, further research was conducted, and this was connected to a physician and a nurse. And the physician had to take an egoless approach. The nurse was having a conversation, and the physician was disagreeing with basically what she was saying. The physician took a step back and responded with care on what could have been improved. He then reflected and modified the communication that the nurse should have been displaying. This demonstrated lifelong learning and the continued support for them to respond and reflect, and in turn turning into the empowerment that happened between the physician and the nurse. In research also conducted by Fisher Boren, students experience growth by confronting their biases and values, attitudes, and beliefs. A further article in 1998 by Tervalman and Murray Garcia stated that a nurse ignored the patient's pain, and the patient was moaning. Due to her stereotype of Hispanic patients, which she expressed she learned in a school that said that Hispanic patients overexpress pain. Because of this, she ignored this patient. What was stated is that in the future, it's important for this nurse to humble herself and assess the experience and culture of each individual patient and not go off of what she has learned in the past, but to be very present to each patient. So as we take a look at this concept of cultural humility, again, we see the diversity and the power imbalance. And as we're looking at cultural humility connected to lifelong learning, we again go over what we learned in the past slides. We need openness, self-awareness, egoless, supportive interaction, and self-reflection and critique. This goes along with the lifelong learning, which will allow empowerment, partnerships, mutual benefit, optimal care, and respect. So some of the critiques found in cultural humility is that there is a comfort with others in this framed self-awareness, where this can be an example of just white versus non-white. The use of culture as a proxy for minority, racial, ethnic groups. And what this looks like is culture is just non-white racial identity. Also, the emphasis on attempting to know and become competent in understanding other cultures. There could be no desire in wanting to actually understand these differences. The lack of transformative social justice agenda that addresses and challenges social inequalities. This challenge is of marginalized communities as individuals and institutional levels. Furthermore, the cultural humility concept needs to be applied more broadly to encompass all pillars of diversity. Daily humility is necessary to those in higher ranks of power. Also, due to low humility in religious views, religious and spiritual identity is important for future or further research. The area of counseling and psychology acknowledges that they must address issues related to culture and diversity. It is not the lack of knowledge, but the need to change attitudes towards diversity that is important here. So some negative consequences that are connected to these cultural differences. Basically, people tend to stick with people who are part of their group instead of opening up their perspectives and experiences. People can feel anxiety and fear when they're confronted with these different views. There's a difficulty in sharing core values, and communities are often divided in differences and choose not to work together. So, an application of cultural humility can include a change in overall perspectives and awareness. This actually happens over time, and creating a cultural framework training would be recommended. Using the tripartite model to research, practice, and train is found in Hook in his 2013 article. This is a model that can be used, again, to help identify areas that are important to cultural humility. Constant self-reflection and self-critique are necessary in being a lifelong reflective learner. Assessing our way of being, our philosophies, and our values. And then building a self-awareness, knowledge, and skill that focuses on interpersonal humility. In addition, reviewing clients' cultural backgrounds and experiences to understand what is the best way to help them. So we're not in a sense just helping, or in a sense just hurting them, but we are understanding what unites to help them. Guide trainees to examine their biases towards racism, classism, and homophobia. Create partnerships with communities to understand the defined population. Create a framework to understand challenges and institutional barriers that impact marginalized communities. And use the individual and organizational questions to assess cultural humility. This was actually from Fisher and Bourne, and we are taking a look at it on this next slide. These are the specific questions that we can ask. These are essential questions for critical self-reflection, and one section is the essential questions to address power imbalances. This is on the individual level versus the institutional level. I will be emailing out this PowerPoint later on this evening, and you can take a look at these questions in your own time. So all in all, cultural humility challenges us to ask the difficult questions. And instead of reducing our clients to a set of norms, this approach allows us to understand individual and community change. I want to thank you for taking the time to listen to this presentation this evening. These are the references and articles that I used throughout my presentation this evening. I again will be emailing out this PowerPoint. I want to thank you, and if you do have questions, please email me at kbland1@seu.edu. I hope that you have a remarkable evening.